the gluteus maximus, and the exercises that might induce hypertrophy in the gluteus maximus. So first of all, let's discuss a little bit about program design. For the last 5 years, program design have evolved a lot. So we used to mainly put our focus on whether intensity or exercise selection. Now we discovered many things that shift our focus in program design, many components that we should put our focus on, like effort, not just intensity, so the effort you're doing during the session, or your repetitions in reserve during the session, the volume that you're using, the resting time, and many other things. In this session, mainly I want to look at the exercise selection. We're going to talk about the exercises that target the glutes. There was a huge debate, and this is something that we're going to talk about online. Many people, when a study is published, first thing what they do is they just take the title and they post it, or they post with it top 5 things. In 2020, we've been seeing a lot of posts saying squats is better than hip thrust. 2022, this changed. 2023, this changed. So let's discuss why, what actually changed. So first of all, my objectives. So what I want from this session is when you leave this room is first of all to understand what's the difference, what's the real difference between hip thrust and squats, and what's the evidence behind that. So we're gonna do a brief critical appraisal about the study, looking at its strong points and its limitations. Second, we're going to look at the key findings and how we can implement it in your exercise program. Remember, most of you here in this room, you're exercise professionals, meaning that you're practitioners. So if you don't learn something and you actually can use it with your client, you probably haven't learned anything. And lastly, we're going to have some takeaway messages that are not just related to the... So we're talking about the hip thrust, where the normal hip thrust you do at the gym, where your back, mid-back is at the bench and you're lifting the butt up and going down. So we're gonna be looking at these exercises because there was a debate, okay, which one activates the glutes more? What used to happen in the past is that we used to rely on EMG studies. EMG is a machine with electrodes that you place on your muscles and you look at the activation. Long ago, we used to think, and some people still think, that EMG is the thing. It indicates which muscle is involved in this exercise. Then we discovered that there's a huge difference between activation and hypertrophy. So if anyone would tell you from now on that I have EMG research or EMG studies saying that in this exercise, this muscle is far more activated, this doesn't mean anything. And I'm sure you read many of these research on many websites showing you which muscle, like for example, which is the best exercise for the biceps, which is the best exercise for triceps or for back, and showing you EMG research. EMG research is not enough because it shows the activation, but activation doesn't have to translate for hypertrophy. Is that clear, guys? Yeah. So, a lot of websites, a lot of people rely on these activation. It just activates the surface. And by the way, there are a huge rate of error with EMGs. This is why we just use it to check the activation, but we also use other methodologies. So, for example, if you want to test the EMG studies on what is the best exercise for your quadriceps, it would be the vertical jump, because your quadriceps are highly active in a vertical jump, but this doesn't translate into hypertrophy. That's why in the latest research we use MRI, we use ultrasounds and biopsies. And this is exactly what they've been using in these studies and many other studies on exercise selections that were published. So the paper that we're going to look at is for Barballo and colleagues. This is not the main paper of my talk today. However, you cannot talk about the comparison between hip thrust and squats and not mention the paper of Barballo. Anyone heard of this paper, please? Raise your hand. Okay, perfect. So Barballo and his colleagues, and that was in 2020. And by the way, whenever you see a paper like this, if you want the paper, you can just get the PMID. So the PMID will lead you to the original paper, which is PubMed identification number. So This paper was published in 2020 and the media went crazy. This paper was saying that squat is better than hip thrust. What they did in this research is they got a group of participants and they were all well-trained women. Well-trained women meaning that they all perform resistance training. They're well-trained women. They've been training for a minimum of 4 years. So that was the inclusion criteria. So they got a group of well-trained women and they split them into 2 groups. A group doing only back squat, the regular high bar squat, not the low bar squat, back squat, barbell squat. And the other group was doing hip thrust. So what they were looking at is which one is going to be better in terms of hypertrophy, which one is going to be better in terms of activation, so EMG obviously, and which one is going to be better in terms of strength. And they're trying to look at crossover strength. So what they did for both groups, they tested their cross-sectional areas, their glute activation, and they looked at the strength of their glute muscles, their strength in squats and in hip thrust, checking if you perform a hip thrust, whether you get stronger in a squat and vice versa. So the results were straightforward, saying that in a squat, the group that performed squat had the bigger glutes. However, let's look at few numbers. So this is the strength. We're looking at the strength here. This is the 1 RM barbell squat. Before their average RM, this is a group average. And by the way, this is one of the limitations in research. They provide you with a group average. So let's say if I'm conducting a research here on a group of 100 plus participants, the number that I will publish is the average. Probably this group here had a higher average, this group here was a lower average. That's why this will change the results a little bit. And that's why we always say this, a research is a piece of the puzzle. It's not the whole thing. So you need multiple pieces just to come up with a conclusion. So what happens here, it shows that the group average RM, squat RM, was 90 kilogram. After the study, meaning after 12 weeks, it was 124 kilograms. You can look at the hip thrust differences. So it was obvious that for the glutes, for example, if you're looking at the glutes, the changes were better when it comes to the squat compared to the differences in hip thrust as size. 1.3 compared to 3.4 when it comes to squat. So this led to this conclusion saying that apparently if you perform a squat, your glutes gets bigger compared to a hip thrust. Are you convinced? There has to be a however, huh? All right, so I'm not sure if you paid attention to one single detail that will change a lot of things. I'm sure you're coaches and you're aware if you're training well-trained people, whether male or females, how long do they need to increase their RM by 30 kilograms? We're not talking about beginners, well-trained people. So how long your client needs to increase in a squat 30 kilograms RM? Definitely not a couple of weeks, right? Sometimes we struggle to add 5 kilograms in a couple of weeks, in several weeks, in several months. Have you noticed here that in barbell squats, the difference was before the study, after the study was 33 kilograms. And we're not talking about beginners. We're talking about well-trained women, 4 years plus training. And that was a big question mark about the study. That most of the social media platforms were like, yeah, we get to the conclusion saying that squat is better than hip thrust. Everybody was sharing it. Everyone was designing these posts. Top 5 things you need to know about squats. That's the best exercise for the glutes. And you know, this is really irritating when you try to elect an exercise to be the best of something. It's like a Miss Universe or something, a competition like that. Although exercises can be the best for you and not the best for you. So it's individual. However, it was online like that. It was portrayed that the best exercise for the glute was squats until there was a paper that actually criticized Barballo and colleagues' paper. So This paper was published right after, like a few months after Barballo and colleagues. It was in September. And it was by Vygotsky and colleagues. They did a statistical analysis, and the result was these and other data from this laboratory were scrutinized and retracted from being improbable. So now you need to forget about Barballo and colleagues' paper. And the debate was still there. People were assessing and were talking about this just from their own opinion until July 2023, we received a preprint. And just to let you know what's a preprint, usually when you conduct a research, for you to publish this research, it takes around a year. So let's say if you conduct a research in a college and you present your manuscript and your manuscript is submitted to a journal, the journal need to conduct a process called peer review. So meaning, if you're a group of exercise scientists, you've conducted a study on squats, you submitted it to a journal to get it published, the journal will send it to a similar group of exercise scientists to review it. This process takes a year. This is why nowadays what they're doing to improve the quality of research, they're publishing the research before completing this process. And mostly the journals are doing this. Journals like British Journal of Sports Medicine, Elsevier, they're doing this. So what happened is there was it's published, by the way, now. This is a pre-print version. The published version was exactly the same. It gets people to comment on the paper. It gets people to talk about it and say what to improve and how we can change, if there's anything we can change before completing the peer review process. This paper was for Polkin and his colleagues. So Polkin and a lot of colleagues, many people were involved. These are the main researchers here. And these are here researchers that supported Polkin and his colleagues. And you can see big names. If you're a fan of Brad Schoenfield, Mano Hanselman, big names in the industry, they participated in this study. What happened here? Now, things were a bit different. First of all, they recruited a group of male and females. And they recruited a bit like a bigger group, 34. 16 were doing the squat, 18 were doing the hip thrust. And by the way, they were untrained candidates, not well-trained, untrained candidates, where usually sometimes we recruit untrained candidates just to see the results and the improvements quickly and try to come up with conclusion. What they were looking at, first of all, if isolation exercises are different than compound. And here they did something extra that wasn't performed in previous paper. They equated the volume. Anyone is aware of the definition of volume, the new definition of volume? We used to use the total number of repetitions. Now we use the total number of hard sets. Sets you can perform close to failure, okay, between 5 to 30 repetitions. So we call this the set volume. So they equated the set volume, they equated the frequency, meaning both groups, the hip thrust, the squat group, they were training twice per week, and they were doing exactly the same number of sets, close to failure. So they tried to control a little bit more variable. Make sense so far? Okay, what happened next? I'm trying to build some excitement, huh? So anyway, so what happened next? The duration was 9 weeks, untrained college-aged athletes, participants. And they were trying to assess the following. Yes, surface EMG, but not only surface EMG, they were also trying to look at cross-sectional area with an MRI. It's considered one of the gold standards in looking at the muscle thickness. It's the MRI, so it's expensive, true, but it's the highest standard in looking at the fat percentage, muscle mass, and so on. And they were looking at a 3RM test, an isometric wall push-up. So trying to see if your strength, if muscle strength is actually increasing when it comes to, if you perform a squat, if your strength improve in a squat and hip thrust, and vice versa. So the results were, they've seen similar results. So I'm going to start with the most important one. They've seen similar results when it comes to hypertrophy in the gluteus maximus between both exercises. So the group doing hip thrust had a similar average to to the group doing squats. However, they couldn't find that strength translate from one group to the other. Meaning, if you perform squats, if you're the squatter group, your strength increased only in a squat, but not significantly when it comes to hip thrust, and vice versa. If you did the hip thrust, your strength increased in a hip thrust, but not in a squat. And this is where specificity comes here. They also noticed that there's a high level of activation of adductor groups when it comes to squats. We already know that, but some people, like some trainers or some educators, they have a question mark if the adductors are activated in a normal squat or in a wide squat. We've noticed that, or they're already active in a whether normal squat or wide stance squat, the adductors were active, so you can read the paper and see that. And the results were, glutes they had the same hypertrophy in a squat and in hip thrust. So what do you think so far? Do we have a conclusion? Is it enough to draw a conclusion that they're the same? Never enough? Okay, let's look at the limitations that were published in the research. Now, every researcher or researcher team tried to publish a set of limitations saying that my study is incomplete because of 1, 2, 3. And this is amazing when it comes to science being objective even towards your own work. But we know that it doesn't work 100% all the time. People criticizing their own work, huh? So probably you criticize it a little bit, but not 100%. So let's look at the limitations they talked about. So these limitations were actually stated in the research paper. And these limitations were the following. So these were young, untrained men and women. And obviously, if the group of participants where you conducted the study was a group of untrained men and women, meaning you cannot actually translate this to a group of trained men and women. You try to conduct another research where you use another group so you can try to come up with a conclusion for different participants. So that's limitation number 1, and it makes sense. Another limitation was that during the study, the gluteus hypertrophy, so the glutes hypertrophy was the main outcome, and it was studied in an MRI. However, checking the hypertrophy of different muscle wasn't easy because in an MRI, they use a coil. So this coil probably was squeezing the thigh, and probably that was the reason why they couldn't see, the hypertrophy in the thighs weren't clear. And it makes sense as well. They talked about as well the training volume that was equated. So meaning they were training the glutes, the exercises twice a week. So probably this apply on any type of training where you train the glutes twice per week. That was another limitation. So broad, easy limitations. And the last one was considering the female's menstrual cycle. And this is always stated when it comes to research paper that recruit female candidates. Although, I'll share with you a secret, when it comes to research, we still don't know the effect of the female's, 100% the effect of the female cycle on training, because it's so debatable. They couldn't observe this neither in experiments, neither in randomized controlled trial. Practically speaking, ladies, I know you're looking at me weirdly, like what? Practically speaking, anecdotally, it's different. In research paper, it's still not proven 100%. Probably because the subjects that they were recruiting, they have no issues in their menstrual cycle. They have an easy menstrual cycle. We don't know yet. But so far, we're not confident to say training during the follicular phase is better than training in the luteal phase. It's still a question mark. Not according to me, according to papers. So they're saying here that it's good to mention that we have female participants and we didn't take into consideration their cycle. So probably this was a limitation and a limiting factor. So that was, these were the limitations stated by the researchers. But guess what? There is something that we conduct at Inspire Fitness Academy is the critical appraisal process. This is not enough for us what the researchers state. We do our own investigation. It starts by searching for every name stated on the paper and checking if they have a conflict of interest. Guess what we find out here when we did this simple exercise? There's a guy contributing called Brett Contreras. Have you heard of Brett Contreras and his nickname? Yeah. The glute guy. The guy who was behind the hip thrust on a research paper comparing the hip thrust to a squat. That doesn't have to be 100% wrong, but it's a question mark for me as a reader. Why this guy is on a paper? Like, imagine the owner of a supplement company is on a paper, is on a study for checking if BCAA is a good supplement or not. Imagine. So would you read this paper? Would you trust this paper 100%? And it's not shocking that BCAA is useless. Anyway, so this was the first thing that we did, is looking at the name of participants, and we've come across Brett Contreras. And another limitation is reading the paper. They said something that, the participants were verbally encouraged to perform all sets to the point of volitionary muscle failure and not muscle failure. What's the difference between volitionary muscle failure and not muscle failure? Muscle failure is the real failure, when you see your client reaching failure. When you see your client cannot perform any single repetition, no matter how much you push them. This is real failure. Volitionary failure is when they feel like they cannot complete the set, they stop. And let me ask you this. If you have a group of people doing a squat and a group of people doing the hip thrust, which one is more taxing? Which one is more challenging for your client to manage? Usually, especially the untrained one. Thank you. So which one your client might stop doing earlier? However, your client probably can still do more repetitions. It's usually the squats. So this was, and again, I'm not drawing conclusions. Don't get me wrong. I'm just drawing question marks. And that's another question mark. And let's continue reading. So this was about volitionary failure. However, again, the exercise form and tempo used were the same as described. However, squat repetitions were not limited to a depth. What? Squats not performed to a specific depth? However, Manu Hanselman posted something a month ago saying everyone is criticizing the study and saying that people didn't go all the way down. Well, it wasn't true. All of them, they went down minimum to parallel. Well, guess what? In the study, you have supplemental material. Pictures showing you the participants' squats. Do you call this a squat? It is a squat for a beginner. I'm fine with it. But if I'm conducting a research, I want something standardized. And by the way, I would love to show you 15 different participants, 16 different participants doing squats. And it's like that. It's not even going to parallel. That's a question mark. So can I really judge a squat that it does similar hypertrophy as the hip thrust? I can't yet. And more on that, another limitation is the blinding process. In research, and this is something interesting and I want you to learn about in case you don't know it already, it's called the blinding process. Blinding process is something we conduct in research just to make sure to avoid biases. If you have a researcher that is excited and is biased towards a squat, or an assessor, and is trying to assess the participants and candidates and is biased, this person is biased towards the squat, they will probably be easy on the assessment or be hard on the assessment just to prove their results. This is why what we do is we try to do the blinding, meaning the assessor doesn't know who they're actually testing, squat group or hip thrust group. Well, they're saying here is that due to logistic constraints, I don't know what kind of logistic constraints will prevent you from doing a simple blinding thing, they were not able to do the blinding for the groups allocated. So that's another question mark. So, plenty of limitations. Where we're at, what do we believe? Now, some people, they're like, see, I told you, don't believe research. They change a lot and they lie, and we start with the conspiracy theory and whatever. But this is not how it works. Every research have its limitations. Every research have its strong points. I'm not saying these guys didn't do an excellent work. They did. However, most of research paper they actually have lots of limitations. Have you heard how many research papers there are there? So we confidently can stand on a stage and say creatine is the most researched supplement. Creatine is safe. Protein is safe. Creatine have more than 1,000 papers published on creatine, and even more. Just go to PubMed, type creatine exercise. Look how many papers you will get. So you need a lot of papers to reach conclusions. Sometimes you might reach a correlation, sometimes you might reach a causation. But for you as a trainer, I don't want you to walk out of this room without context, because that's the most important part. It's not important to get a certificate or certification or a title, and however, I cannot put things into a context. At the end of the day, most important part for me is your client. How are you gonna treat your client? How are you gonna help your client? So if whatever I'm gonna talk about it here is not leading to a point where you can actually translate this knowledge to improve your client's life and make them reach their goals, I'm not doing my job right, you're not doing your job right. So how can we change this? First of all, I want to remind you or explain the evidence-based practice model. So probably it's something new to you, probably it's not. It would be a reminder. Evidence-based practice model is something that started as the evidence-based medicine model. For years, medical doctors, a lot of medical doctors, and until now, by the way, they start to, talk about recommendations that are not supported by any research. I'm sure you've heard a lot of people go online and talk about how sugar is bad for your health and it's like poison. I'm not saying, eat sugar and have sugar as much as you want, but I'm saying it's not poison. It's sugar. Having it in moderation would not kill anyone. It's simply sugar. And talking about the effect of sugar and insulin, that sugar and high glycemic sugar can spike insulin, meaning that it will result in a bigger body composition or like obesity and overweight. It's not according to research, I'm sorry, and high quality research experiments, multiple experiments. So that's why, medical doctors used to go out there and say a couple of recommendations, and this is dangerous because people believe them blindly, and I'm sure you know what I'm talking about. Sometimes your client would be training peacefully, pain-free, and suddenly your client come back and say, my doctor said I should stop because there's a lumbar disc, and I should do physical therapy before I continue with you. Lots of evidence are showing that the best cure for that is gradually loading the muscles around the spine and movement. Not stop exercising. Or, for example, you've heard this, when it comes to pregnant women, asking pregnant women to stop exercising the first 3 months just to guarantee pregnancy, that it's there and it's working properly for the first 3 months. Doesn't make any sense, neither in biology or physiology or research or anywhere. However, they used to generalize these recommendations. This is why the American Medical Association and multiple other associations, they were like, hold it right there. Any recommendation should be supported by a form of evidence. Look at this simple example. If you're trying to find out who stole whatever, the clicker, how would you have the suspects and, finally you confirm who stole the clicker? You need evidence, you need camera footages, you need a source of evidence. How would you confirm what you're saying is true? What do you need? Evidence. Can you say it, please? Evidence. Whatever you're saying to your client should have what? Evidence. If you're saying to your client that, you need to do postural correction before they start doing their exercises, please have some evidence. If you want to tell your client that, yeah, this is a bad posture and this is a good posture, you need evidence, because you know why? Why I'm saying this? Because there's no evidence for a good or bad posture. I'm sorry if you already paid a lot of money on corrective exercise courses, but there's no evidence saying this is a good posture and this is a bad posture. You know from where it's coming from, good posture and bad posture? From public speaking. You might have rounded shoulders, live your life pain-free, lift heavy weights, and you're fine. You might have a lordosis and be the best power lifter or be the best athlete, and you might have a what they call text neck and still lift and live your life peacefully. not according to corrective exercise. Why? Because we can easily create a problem, have a solution, sell you a certification, and you start selling training. What's the evidence behind it? Nothing. So what's the evidence-based practice model? It was translated from the evidence-based medicine model, saying that first, find an evidence, find a research. So this is why I always recommend for trainers, and I'm like really grateful for this opportunity to speak in front of you in this room tonight, because I get to spread the message, and I hope you spread the message more. You cannot anymore give recommendations without being able to look at papers, and trainers need to learn nowadays, not just how to take a course and trust the instructor and the book blindly, even if it's coming from whatever country, even if it's accredited by whatever organization. You need to start learning how to read research paper, original research paper, and how to conduct a simple critical appraisal, or at least follow people who do that. And there are lots of researchers who do that. By providing the actual movement with small modifications according to their level. Let me, since you asked about this, let me just add this example. This is a concept on fixing a rounded shoulders. They ask you to release the chest muscles. By the way, disclaimer, I used to teach corrective exercises. 2007. So release your chest muscles, strengthen your back muscles, and you will get a better posture, right? So the logic was, if I strengthen my trapezius muscle doing this, if I stretch my pec minor and pec major doing stretches, I'm gonna fix my lordosis, right? Question number one, why do you think you need to fix it? If it's for a public speech, stand straight. If it's for your workout, pain-free, you can still work out properly. You don't need to fix anything. And finally, this is the key thing, and hold on for this. If you're saying that you can strengthen your trapezius, so your trapezius on its own, pull your scapula, why don't you train your anterior, when you train your anterior deltoid with front raise, your arm wouldn't stay like this all the time, and you walk like this on the street. Ask your corrective exercise tutors this. Ask them if they have actual experiment that they got a group of people, they asked them to do these special exercises, and the other group did just the chest press, back, shoulder, lateral raise, the exercises, just they were active. And they compared the difference. Ask them if they have this experiment, and if they do, what's the results? And trust me, what they will say is that I have a master's degree and I don't need to look at research. And that's the problem. Even if you have a master's degree, it doesn't tell anything. If you're trying to fight me that you're an expert and saying that, yeah, because I have a master's degree, that means I know everything, case closed. So guys, what I'm asking you here, don't believe me. Just raise more question marks. That's it. Going back here. So you add your experience, your expertise. So if you read this paper saying that squat is better, or they're the same, so which one should I use? Well, which one can you actually apply? Which one actually you can teach to your client and they can do it properly based on your own experience? Use your own experience. And finally, the most important one, client preference. Client preference. Because if you chose an intervention that is great and supported by research, and it's according to your expertise, however, your client is not enjoying this intervention, meaning this is a useless intervention. So that's why the evidence-based practice model, I consider it more as a funnel. Whatever intervention you're teaching, so tomorrow when you're designing this exercise program, and I really hope that you do design an exercise program, because it's rare to find personal trainers designing an exercise program. Most of them, they improvise before the session. Oh, I don't have time. Well, why you're getting paid to design an exercise program? So I hope when you're doing this tomorrow to think, why I'm including this exercise, and why I'm adding this. Is it really, like supported by some form of evidence? Is it really will take my client forward? Is it something that my client prefer doing? Because what we've been forgetting about for years is the behavioral change, is the psychology part, the psychological aspect. And we're like just giving, like interventions to our clients and asking our clients to do it without looking at our clients if they're actually doing this intervention or not, if it's actually something they're enjoying. So this is the evidence-based practice model. And when we talk about evidence, I'll keep this for you. By the way, you're going to receive the slides. So when you access the platform, you will get these to download. Feel free to take pictures as much as you want and make me famous. And just, read this when you have time and try to look at the different categories of evidence. Usually we say that the highest quality is systematic review and meta-analysis. Try to understand a little bit more what's a systematic review and meta-analysis. And I'll share with you a inside information. Since you've attended this educational day, you can know this information earlier than other. We're working on a free course for public that will teach people the basics of what's a meta-analysis, what's a systematic review, how to conduct a basic critical appraisal that will be launched in the next 3 months. So stay tuned for that because we want to support trainers to read more research. So this will show you the level of evidence. This will show you the difference between observation, experiment, and review research. It is true, this is saying that review research is actually like the best form of research. It's not the case all the time. And when I will go back here and talk about the diastasis recti, I will show you that there were some papers on diastasis recti that were systematic review and meta-analysis, but they were low quality. And I will talk about it. Why? Finally, my take-home message to you is the following. When it comes to studies, doesn't have to the study. You don't have to read a study in an approach or in a way where you're waiting for the final answer. So what's the conclusion? Please tell me what's the solution. What should I do next? Squats or hip thrust? Similar, another study as well talked about which one is better for the hamstring, seated or lying leg curl. But remember, guys, one thing, it's very important that these research are according to a group of people that went to a lab and did a certain protocol. If both exercises have similarities, choose the one that your client can apply, that will take your client further, that your client enjoy doing. So if your client enjoy doing squat, let them do squats. If they enjoy doing hip thrust, let them do hip thrust. And the best is a combination of both. So you can target different planes, so you can target different motion and different vectors. So another thing is that each study is a piece of a large puzzle. The more studies you read, you will have a clear picture. Also, adhere to evidence-based practice model that we actually talked about. And always remember that studies are important, but also your client's psychology and behavior, it's very important. Because at the end of the day, if you use and read tons of research and you cannot apply it in a way where your client come back and they want to train more, you're not doing anything at all. Any question?